Jeff, thank you again for joining us today. And we really just wanted to take this opportunity to have a short conversation to learn a little bit about what STOPit is working on and what you're seeing across all your clients and what information you're gathering that might be helpful to public entity pools. And we know STOPit is just a great supporter of pools. You work with so many pools, you work with so many school districts directly, and you're always enthusiastic about participating in AGRiP. So we're very, very appreciative that you're taking the time with us today.
And us too, thank you.
I thought we'd start broad today. And as I said, I mean, we know you work with a number of pools, but you also work directly with other public entity clients and other non-public entity clients. So I mean, we're real curious as to what you're seeing across all of your clients, across all of your relationships right now in the COVID-19 crisis. And, you know, what of those trends you're seeing or those issues you're seeing, do you think it would be really important for public entity pools to think about or to know?
Sure. So thanks for that question. So I'd like to start with for the K-12 schools. So we are constantly getting feedback from many schools, and obviously with the COVID-19 social distancing, that it was a big change for them. What we found from our K-12 schools, and we still are able to communicate with them and say, hey, you know, what are you experiencing and how's home learning going, is that it's interestingly enough, they were looking for a lot of content to share with students and staff while home learning. Some of that content was mental health content. Also, for online learning content, they wanted to use that as part of their curriculum to share with the students. Small little vignettes so that they could say to the kids, to the students, hey, this is something that's important for you to recognize, like cyber safety, right? The inappropriate use of social media apps, and be kind and be respectful. That's what we're getting a lot of feedback on. So what we did was actually created a video library for them to be able to utilize in these home learning situations for each individual teacher to say, hey, here's a 5-minute lesson, followed up with questions, what they've learned, because they're looking for content. One part of the feedback we've gotten from schools, from 12 schools.
So that's really interesting, like a new focus on mental health, on overall student wellness, on caretaking for the individual is a lot of what I'm
Yes,
yeah.
That's correct. That's correct. And, you know, also the feedback we're getting, we get inquiries, believe it or not, during this time where schools are closed, but administrators are still working from home. And that is that they were concerned about, believe it or not, an issue with abuse at home. And also, like I had said, the inability for kids to have a social outlet at school, physically, with activities at school and face-to-face with their peers, that they were using social media apps inappropriately to communicate, because that's where they communicate mostly, and so do we, obviously.
Right.
The abuse situations, we've had some districts that say, look, we're concerned because the kids are at home and there's some abusive situations out there that you know, especially with unemployment issues, where there could be a child who is abused at home. So they want to implement our solution for them to anonymously report if they indeed need assistance to report an incident, if you will. So that was interesting that we found.
Yeah, so that online reporting tool and that anonymous reporting tool is maybe just as important at times where the schools are all distance learning, right? For different reasons, but still critical.
That's correct. Yes. Yeah, that was eye-opening to us.
So is there anything, you know, other than that? I mean, those are all issues that are really pertinent to pools who have school districts as members. Is there anything else specific that comes to mind that's, you know, unique to that public entity pooling environment and what you're seeing or thinking about, or how you see the solution being used that you think pools should be paying close attention to?
Well, so I'm in constant contact with over 40 public entity pool customers, municipal and education, obviously. So, you know, I constantly ask the same questions. You know, what are you going through? You know, what feedback are you getting from your member insureds? First of all, at this time of year, our public entity pools are so focused on renewals. right? Having their member insured sign up and so forth. And I've gotten some feedback from them in reference to saying that, look, we're finding that majority of our member insureds, in mostly 100%, are not really shopping insurance because of the situation that they're in, so that their renewals are very high. They are acquiring some new member insureds, but they want to focus in on maintaining their existing members, obviously, and going forward from there. So that's what I found, that the retention is mostly important. It's been unaffected by this COVID-19 pandemic.
Yeah, and that sort of makes sense, right? Because this is the time when pools really shine and when that totality of all the services they offer their members are what's so important to the members, and just being there and being that steadfast partner. So it makes sense that you would be hearing that. I'm glad to hear that for sure. Yeah. Have you talked to any pools, or do you have any sense, I'm just thinking again about drawing those connections of mental health and wellness, and the combination of school situations and home situations. What do you think of when you think of the future of the next, year down the road? What will the COVID-19 experience look like a year and a half from now? Will this be helpful, do you think, like the focus on student mental health and online appropriateness, or is it going to just exacerbate some of the issues? I don't know.
Well, so I could tell you that I do think that there is certainly something to be learned about this now, especially with home learning. And some of our public entity pools have shared with us in the very beginning, saying, "Hey, look, right now, Jeff, is it possible I could speak to you in a couple of weeks? Because right now we're trying to support, or we are supporting our member insureds of setting up the technology for home learning." We're also looking at how we can provide in the education public entity pool, how they can provide food for those on the lunch program. Also, some other feedback is concerning with a student if they have an IEP, an individual education plan, where their issue is that now it's a video conference and the administrator or the counselor or the IEP team didn't know who was in the room along with that particular student and or parent who was allowed to be in the room. So we've gotten feedback from them saying, these are the issues that we're dealing with. And I'm confident that this is a good learning experience for them so that they are prepared in advance for something like this if it happens in the future.
Yeah, for sure. That's interesting.
It is interesting.
Yeah, so you mentioned the video library that STOPit has introduced. Are there other products, services, elements of what you're doing now that maybe are different or particularly valuable that you think pools should really know about?
Well, yes, what we've done is we found that there was a lack of professionally developed mental health content, specifically for K-12 schools. In our anonymous reporting solution, when a student reaches out and says, "Hey, this is how I'm feeling, can you help me?" The lack of resources for the administrator to be able to quickly and easily access this mental health content based on whatever issue that student may be reporting on or asking for guidance, that they could learn more about what the student may be feeling, and also to point them in direction of where to get help. But also in our product is our Social Emotional Learning Center, which we call our SEL Center. It's accessed quickly on our incident management system that administrators monitor and manage reported incidents, that they can actually choose student-facing content, Anne, so that they can actually share it with that student to help them learn. These are like small 2 to 3 minute vignettes, if you will, some video, and content so that they can learn more about what they're going through, where they can get help. And the administration can share this through our two-way communication, our STOPit Messenger, where it's a two-way communication back and forth. But also what's important is that we've found that the mental health issues, which is a rising concern for education, the education pools and their member insureds, is that we provide them with real-time reporting of what's happening and where it's happening and based on incident type, so that an individual school within a district can say, "Hey, this is what's happening in our school, in our community with our students and faculty." And they're able to look at it and say, hey, you know what? In the last 90 days, we've seen increasing concern with, let's just say, depression as an example. So the administration at that school can choose now to use a function which we call broadcast notifications, where they can share one of these mental health topics. And I think we have over 90 mental health topics broken down into different categories to choose from that they can quickly share and send out to all the students, or just to the parents, or to all the community, the faculty and staff and so forth. So we found that that's very valuable.
Yeah, I got to think that real-time feedback loop, right? So you're going to tailor the content. The school is able to really tailor the content that's most timely, that's most responsive to whatever their students are feeling and dealing with right at the moment, right? That's pretty cool.
Yes, and for each individual student as well, what they're going through. So that's where the two-way communication helps tremendously.
And so that sounds like it is, I mean, that sounds pretty sort of soup to nuts, right? Like it starts with a triage tool for the administrator to understand what they're dealing with and what kind of resources to pin to that particular need. And then through the training and through the data, that feedback loop, right? Did I get that right?
That's correct. That's exactly right.
Okay. Anything else that you'd want to call out, or is that really the main benefit right now, main program benefit?
It is with giving a tool to the for the kids to report, and employees as well, to report via mobile app when they're at home, any incidents and issues. We did see in the first 2 to 3 week period of social distancing a decline in the number of reports submitted, and we chalked that up to the home learning setup and the technology and everybody getting their plan of action and curriculum together.
Right.
But then we saw an uptick again with reported incidents, and so we want to make sure that that the students have an outlet, that the employees have an outlet to report these types of things. So it's also a cloud-based system, so the administrators, whether it be an HR director or city administrator or a principal or assistant principal or whomever, a guidance counselor, can access this in real time right from their mobile device and monitor and manage incidents.
So I was going to ask that about the trends. So thanks for anticipating that question and saying that reporting went down and now it's back up. Is it back up to normal levels yet, do you think? Do you know?
No, it isn't up to normal levels.
Okay.
No, just shy, I'd say about 20% less.
Okay.
Saying over the last 12-month period, we've seen close to 60,000 reported incidents across our customer database. But I would say maybe over the last 3 week period, a 20% shy of the norm.
Boy, Jeff, it's going to be incredible to look at that data, you know, down the road, 6 months, 12 months down the road, and see what lessons it teaches us about these kinds of incidents and what to expect for anything in the future that we might face along these.
Yeah, specifically during this time period. Sure.
Right.
Absolutely. I agree.
As we wrap it up, you've got 7 people in your own household. You're getting outside, getting some vitamin D, getting some walks in. What else are you getting any alone time? Like, what do? Do you step away from them just to kind of keep yourself whole and happy and healthy?
Well, I have to tell you that I am spending a lot of alone time. But if you want to call this alone time, okay. Not really, right?
It's not.
But I'm in the basement in my office, and we have 3 floors. So all of us have our own section, our business office, if you will, to conduct business or online learning or whatever it may be. So my alone time is, 7 o'clock in the morning till 5:30, 6 o'clock at night, because I can tell you that I still have, although K-12 schools are closed,
Yeah.
My responsibility here is the insurance and public entity relationship. So they're in business, they're communicating with me and the like. So that's my alone time. 7 in the morning, 5:30 at night. I call it alone time. I have to go up and have lunch.
You get another cup of coffee or whatever it is.
That's right. Yeah. That's exactly right. Every once in a while I get a visitor.
Very good. Well, again, thank you for taking the time to talk to us today. Thanks for sharing all the information and resources. And yeah, just thank you and stay safe.
Thank you, Anne. Appreciate it.